Let's start off with the disease that everyone has heard of, rabies. One fine day, you and your buddies decide to play a dumb game of truth and dare. When your turn comes, you choose dare. There's an aggressive stray dog in your neighborhood. Inside the dog, an unseen microscopic killer is already at work, and no one knows it. Fully aware of how fearsome the dog is, your friends dare you to go and kick it. Now you, Mr. Batman, try to sneak up behind the dog to land the kick, but at the last second, it notices. It turns and lunges straight at you. You yank your leg and run, but the dog managed to bite you. Your friends didn't see it, as they were already sprinting ahead. After reaching a safe distance, your friends cheer. To them, it is a win, and you feel like Hercules. Your pride swells, and you decide to keep the bite a secret. You go home and rinse it with water. No vaccination, because that would mean screaming to everyone that you were bitten. You brush it off, convinced it's nothing serious. But inside that bite wound, a disaster has just begun. And the villain is a virus. But unlike many viruses, this one doesn't like to race in Formula 1. It spreads through the saliva of infected animals, most commonly dogs, but also cats, bats, foxes, and raccoons.
Oh, hell no!
This virus attacks the nervous system. It moves silently through your peripheral nerves, traveling slowly towards your brain like your grandpa's old crappy car. This can take weeks, sometimes months, and this is the window where this virus can be stopped. If you wash the wound thoroughly and receive post-exposure vaccination immediately, it is preventable. But if nothing is done and the virus reaches the brain, your ticket has just got booked, and this rocket ship to afterlife is called rabies virus. The early symptoms may seem harmless: fever, headache, fatigue, tingling and itching at the site of the bite. But then the final phase begins. You feel agitated, start hallucinating, and also you're confused, but you don't notice that because you're confused all the time anyways. Saliva keeps pouring out of your mouth like someone holding a premium steak to your face. Hyperactivity and aggressive behavior follows. And then the last boss appears. You start fearing the water, not because there's a shark or a crack in it, but because the muscles in your throat spasm painfully whenever you try to drink water. Even the sight or sound of water can trigger violent spasms. Once the symptoms start appearing, it's game over for you, and the next level starts in afterlife. Let's move on to the next most painful disease, Ebola virus disease. Imagine you're in an airport waiting for your flight. You notice an empty seat and decide to sit down. There is a person sitting right next to you who seems to be in pain. He's sweating and is barely able to sit properly. You see his condition and ask if he's alright. He is slowly collapsing due to the pain, so you hold his shoulders. Suddenly, he starts coughing and then ends up vomiting. You take him to the restroom and help him get cleaned. Afterwards, you wash your hands just with water and then carry on like nothing happened. Congratulations! You may not have boarded the airplane yet, but a deadly virus has already boarded your body. This virus belongs to the genus Ebola virus, commonly known as Ebola virus. This is John Wick, but in the shape of a virus. This virus is pretty old school and spreads to humans through USB cables. Direct contact with blood, secretions, or other bodily fluids of infected animals. Fruit bats are believed to serve as the natural host of Ebola virus, but animals such as bats, monkeys, apes, or forest antelopes also carry them, whether dead or alive. Once a human is infected, human-to-human transmission phase begins. It spreads through blood, vomit, feces, sweat, saliva, or contaminated objects. After exposure, symptoms can appear anywhere from 2 to 21 days later. At first, it may feel ordinary: a sudden fever, headache, muscle pain, weakness, sore throat. But then the virus begins attacking the immune cells and blood vessel linings. It triggers an overwhelming immune response, often called a cytokine storm. Blood vessels become damaged and leaky. The clotting mechanisms malfunction. You'll begin vomiting. Severe diarrhea follows. Intense abdominal pain sets in. And then, the last dance. Your symptoms will worsen rapidly. You will experience confusion, internal and external bleeding from the gums, nose, eyes, or into the stool. And your body will struggle to maintain blood pressure. You remain in constant pain as multiple organs begin to fail. Soon, death follows due to hypovolemic shock. Next on our list is necrotizing fasciitis. This time, you're one hell of a lucky person. I know you're single, and that's exactly why I found your partner. You're in the kitchen peeling vegetables for dinner when the knife slips. It's not a glitch in the matrix, just a cut on your finger. It looks minor, but the blade slid deeper than you realized. Blood slowly seeps out. Your partner rushes to you. Instinctively, they try to help. They take your finger into their mouth, sucking at the cut until the bleeding finally stops. When your partner stops being a vampire, you rinse your finger quickly under water, but do not disinfect it. Lucky for you, your partner has strep throat. In a normal situation, nothing would happen. Just an accident in the kitchen. But like I said earlier, you are an extremely rare case. And your Twilight saga is about to end. Voila! The time bomb has been planted on your finger. And you have only about a day before you're forced to rush to the hospital. Necrotizing fasciitis is a terrifying disease caused by more than one type of bacteria. It is a rapidly progressing bacterial infection occurring under the skin and the muscle. It even has a cool nickname, the flesh-eating disease. There are 4 types of necrotizing fasciitis. Type 1, 2, 3, and 4. But we will only focus on type 2 because it is particularly aggressive, and unlike the others, it often affects even healthy individuals. The most common cause is group Streptococcus, the same bacteria responsible for strep throat. The bacteria can enter the body through minor skin breaks, cuts, surgical wounds, or even insect bites. Once inside, it multiplies rapidly beneath the skin. They release powerful enzymes and toxins that destroy tissue, blood vessels, and muscle, cutting off blood supply and allowing the infection to travel quickly along the muscle fascia. What comes next is swelling near the infected area. The skin will turn redder and redder. You'll feel severe pain that's not just exclusive to the visibly infected area. Fever follows as your immune system tries to fight back. As blood supply collapses even further, your skin will turn purple, then grey. Earlier it was red. What's next? You'll turn into rainbow. Fluid-filled blisters begin to form. The intense pain suddenly decreases, indicating nerve destruction. Gradually the toxins will enter the bloodstream. Your body will enter a state known as systemic inflammatory response syndrome. The toxins act as superantigens, triggering massive immune activation and a cytokine surge. And with that, multiple organs will begin to fail. You are in a race against time because without urgent surgical debridement, mortality is extremely high. Up next is one of the deadliest cancers, pancreatic cancer. Time has changed, things are different. You are single again, miserably alone, so you download a stupid dating app. You somehow get lucky and find a match. Congrats! The 2 of you plan a date. You are really excited about it, and at last, you step out of your cave. You arrive early. Oh, funny. You wait 5 minutes, 10 minutes. Your heart is racing, not from excitement, but from pain. Now comes a deep pressure in your upper abdomen, a dull pain that goes all the way to your back. It's nothing new, you've felt this before. Looking back, over the past few months, you have also been losing weight without trying. But that's not something you should be happy about. Fatigue was always there, and your skin was turning yellow. You didn't think much of it. You told yourself it was nothing serious. Probably gastritis or too much coffee. So you're a doctor now. The pain intensifies, sharp and relentless, and you collapse on the ground. Strangers rush to your aid, someone calls an ambulance. You wake up in a hospital bed, not beside a date, but with stage 4 pancreatic cancer, and you have less than a year to live. Pancreas is an organ about the size of your hand, hiding behind your stomach. Most pancreatic cancers arise from exocrine cells, and one is by far more common and more lethal than the rest. This is pancreatic ductal adenocarcinoma, or PDAC in short, an exocrine cancer. The earliest possible symptoms are very subtle and only appears after the tumor has already developed. Unexplained fatigue, loss of appetite, mild epigastric discomfort, vague abdominal pain. Symptoms commonly associated with many benign conditions that you ignored, like your credit card bill. At the later stages, the cancer cells travel through the bloodstream and seed new tumors in other organs like the liver and lungs. This is when things get out of hand. You may sense a deep, boring pain in the upper abdomen that radiates straight through to the back. As it progresses, severe back pain becomes common. Many patients require strong opioid medications just to function. You may develop jaundice, yellowing of the skin and eyes. But it's not just cosmetic. It causes intense itching all over your body. Then there's digestive failure. You may suffer rapid weight loss, and not just any weight loss, but something called cancer cachexia. This is extreme muscle wasting, weakness, fatigue so severe that even walking becomes exhausting, and you may become wheelchair bound. The pain will only intensify over time as your organs start to dysfunction. And once these symptoms start appearing, you have only 3% chance of survival. Because when it comes to pancreatic cancer, early diagnostic is everything. Next one on the line is meningococcal disease. This time you're young, active, healthy individual, not so healthy individual. Living in a shared household, you and your roommates thrive on late night parties and concerts. Hanging out with your friends and passing the cigarettes is a daily routine for you. By this point, there is a real chance the killer is already living inside you. Most people who carry it won't develop an invasive disease, but you are not the most cases. You are an exceptional guinea pig for our experiment. And then you catch the flu. This is not a stretch. Flu is common and happens all the time. But flu, plus smoking, plus the killer, and the exceptional your hell has just begun. Meningococcal disease is a life-threatening bacterial infection caused by Neisseria meningitidis. It leads to either meningitis, meningococcemia, or both at once. Around 5 to 25% of the general population quietly carries this bacterium in the nose and throat without ever becoming ill. So much for an intelligent species. A carrier can spread it through respiratory droplets or close, prolonged contact like deep intense kissing, coughing, or sneezing. Shared items contaminated with saliva like drinks or cigarettes, or simply living in a shared household can also transmit the bacteria. Most people carry the bacteria without symptoms, but in rare cases, it is able to invade the bloodstream, most often in previously healthy children, teenagers, or young adults. And that's when life can alter. Once in the blood, the bacteria will multiply rapidly. They release potent endotoxins that damage blood vessels and trigger an overwhelming immune response. Early symptoms may seem ordinary to you: a sudden fever, mild headache, accompanied by nausea and vomiting. But within hours, the condition can escalate dramatically. Extreme pain in the chest, joints, and the muscles. Your skin will develop small reddish-purple spots, which can quickly enlarge into dark purple blotches. It is a critical sign of bloodstream infection. You will feel breathlessness. Your mild headache will turn severe. Neck stiffness follows. You won't be able to move your neck without pain. Sensitivity to bright light is common. In severe cases, seizures can occur. As the infection progresses, blood pressure can collapse further, and organ failure can develop. All of this can unfold within 24 hours of the first symptoms, and sometimes even faster. Without rapid antibiotic treatment, the disease can be fatal, and even with treatment, the risks remain significant, including brain damage or limb amputation.